All right, this is Chapter 4, Certified Medical Assistant. We are in the study guide, page 44, Respiratory System. Okay, the anatomy of the respiratory system. Y'all, you know, there's not a lot going on here. There's a lot going on, but as far as structures, not a lot. You know, not too many structures to have to remember. The term respiration refers to the act of breathing. You need to know what inspiration means. In. That's taking in oxygen. And expiration or exhaling. Giving off carbon dioxide. That's what you're doing when you're breathing in oxygen. Releasing, exhaling oxygen. Carbon dioxide, sorry. The respiratory system consists of those organs. Nose, oral cavity, your throat, better known as pharynx, or pharynx, better known as throat. Voice box, which is your larynx. Windpipe is your trachea. Bronchi and your lungs. Then they're going to want you to know what's in the upper respiratory and the lower respiratory. Everything all the way down to your trachea is your upper, which is your nose, your nasal cavities, your sinuses, all your sinuses. They just go through all that. Your larynx and your trachea. After your trachea, it gets to your bronchial tubes, which are like the roots of your lungs. And then it branches off, and then it goes into your lungs, and then the bitty exchange happens in your alveoli. That's what they call the air sacs. Those are the ones that actually sit right up to your capillaries, and they got all this little permeable stuff there. That's where all your exchanges happen, in those alveoli. Those are what's most important in your lungs. Organs. We know what the nose is. We have nostrils or nares. Underline that. That's what we say when we're describing the nose. And when you're giving medication, they'll say right nare or nostril. It really depends on who it is. But that's how they'll order it. Just also know that we have, and you can underline this as well, your nasal, frontal, maxillary, ethmoid, and sphenoid bones help form the cavity wall of your nose, of your sinuses of your nose. And a sinus actually just means, everybody thinks sinuses is sinuses, which they are, but it's an opening within. That's what sinus means, an opening within. And because you got sinuses other places as well. But you know, when somebody says sinus, I got a sinus problem, you know, we go straight here. But you got sinuses other places. Nose is made of cartilage. Underline it. It's made of cartilage. Pharynx is your throat. Just underline that first sentence. It is shared by the respiratory and digestive system. That's where you might get choked up as well. We want to, when we swallow and it goes to the wrong place, or we get... And you know, you feel that feeling. It's actually, they go on in your lungs. And we always worry anyway, because that's your lungs. Your lungs actually clean itself all day, every day. It's got these little things inside that's moving trash out of the way. And it goes up into your trachea and back down. Or I should say right there at your larynx. You're always going, that kind of thing. That is your lungs are cleaning itself. Sometimes you know it, sometimes you don't. Sometimes it's a build-up, so, you know, or you'll feel it. Most of the time you're not feeling it. It's happening, but your lungs are cleaning itself all day. That's another reason why drinking fluids is paramount to keep your lungs healthy. So they won't be stagnant, and if your stuff can't help move stuff out of the way, it sits there, and guess what we're going to get? All kind of things. So always keep your fluids going. And moving, walking, all that kind of stuff helps them lungs keep itself clean. So does all your body parts. All that movement in water keeps everything nice and smooth and not thick, so it can be fixed or cleaned. Your larynx, just put right beside that your voice box. Just like for the pharynx, put your throat. Your larynx, that's your voice box. It's also made of cartilage, all different kind of cartilages. And the epiglottis, epiglottis. It closes while you're swallowing, therefore preventing food from entering the respiratory system. Underline that. That is right there. Just to know this as well, that coughing is a protective reflex, and that's what it does. It coughs, you cough, or and that gets that little bit out of the way, and it goes down your throat. And you swallow it instead of it go down into your lungs. Things that go into your lungs, we call that aspiration, and it can be bad. Be look out for that. Trachea, another name for your windpipe. That's the tubular structure that goes all the way down. And it actually branches into your right and left bronchi. And the bronchi is the big branches. And I always think of, like a tree, the root of a tree, the tree trunk. It's like the trunk. The bronchi is like a trunk, but trachea goes right there to the trunks of your bronchi. Flip on. There's your bronchi. You got your right and your left. Left, you got 2 lobes, underline that, and your right, you got 3 lobes. A girl tried to remember to the left, to the left, to the left, but she could always remember 2 lobes on the left. But I remember that song. Y'all remember that song? To the left. And that's the same with your heart too. To the left, two valves on your left, to the left. But that's a good way to remember it. Then comes your bronchi is the tree trunk. And then the tree is your lungs. And then all you're exchanging, and it's kind of the transportation system getting to where it really needs to go, which is the little bitty alveoli, which they really don't have a little section for alveoli, but that's okay. The lungs is the pair of organs in the pleural cavities. Underline. Each lung has a helix. And a helix is just a slit or a place where it goes into your lungs, where all your stuff goes into your lungs. Kidneys have one too. You know, think about how your kidneys are structured. They got that little trunk that goes into the kidney bean. And just like that. That's the little helix where all the little stuff goes into that little section there. And, the kidneys have a helix too, so you do your lungs. But that's the helix where everything goes in. And there is your bronchi going into your lungs. And into your bronchial tubes. That's the magic words. Underline bronchial tubes. Your lymphatics, nerves, and bronchial tubes go into the helix, which is just a little part of the place in the middle. And they call it the helix. Your pleural cavity is lined with serous membrane. Remember how I told you the brain is protected? And so the skull is protected or lined, and then your brain is protected, and then you have a barrier. Same as your lungs, you have that same barrier as well. They just call it different. Your parietal pleural lines the thoracic walls. And that's going to be like it's lining the outside. Like you don't want to hit your lungs up against your bones all the time. So that's your parietal pleural. And then the visceral, and every time it says something visceral, it's attached to the organ. It is like the skin of that organ. So visceral pleural covers the lung surface. I always say that's the saran wrap. Holding the lung in there and together. That's your visceral. And the parietal is actually cushioning the bone, so you don't be hitting your lungs to get your bones. And those are your pleural cavities. When people get fluid in their lungs or lung punctured or shot, that right there can mess them up pretty bad when that goes wrong.
So do it get messed up when people perform CPR?
No, not so much unless you done broke something and it puncture things. But
Because the patient had coded and they got a machine that would do the CPR.
yes, I've heard about that machine.
Yeah,
They say it's pretty good. Because people get tired, and if you've ever seen it, they want the big men. We started off, but they're going to get the guys who, it's not even, they didn't have no medical experience, but they know how to do CPR. They might be the trash man, but they are the big ones with some muscles.
Yeah.
And that's what you need, somebody with some stamina that's going to be on it and
they
not
had that
stopping.
machine on him, but he didn't make it.
That's terrible.
Yeah,
If something punctures that area, things like that, normally it doesn't get messed up. Do all kinds of things, but punctures, breaks, shots. Shots as in shot. Can mess that stuff up. sometimes a leakage in that digestive, something that fluid may get into the wrong places as well. But something probably had to happen, some kind of infection, something got in the wrong place somehow.
Well, who had a heart attack today? He was cold on the way to the hospital. They say he got hurt at work sometime. And so they
That worked too. You know that was
yeah,
unexpected.
and I don't even think he was from around. So he got hurt at work. They brought him there. They said he was cold. They got him and when they got him in the CT scan, he cold again, and he didn't know coming around that time.
Where did he work at? Do you know?
They didn't say.
Oh.
They said it, but I don't remember.
Yeah.
They worked on it for like 45 minutes.
Yeah. Oh, they don't give up on
The
them.
family didn't want him to stop.
They don't give up on them, especially if
He
they're
started
young
doing
and they
that.
were working.
He was 54.
You know, that's young.
That was very nice. Right.
Yeah, that's young for somebody. You know, you may stop working on me when I turn 90. Otherwise, I need you to keep it up. But that's what they'll work, because you know they'll get it back started. That's why they steady gonna do that. Keep the flowing,
Yeah, they was
just in case.
Giving him the medicine and everything.
Yeah. They was working on it. Apnea. Know the definition. What does A stand for? The absence of breathing. So we kind of touched that back. What we were talking about a little earlier, but apnea is known as respiratory arrest. And underline this last few parts here. Apnea just you're not breathing, and if you have sleep apnea, you're not breathing in your sleep. If apnea does occur, artificial respiration is required. And they dig into this by the words, by this last sentence. So know this like it's a Bible verse. Artificial respiration refers to the measures taken to cause air to flow into the lungs by expansion of the chest cavity. You would think all kind of different things, expansion or pull of your diaphragm or whatever, but the word they want is by expansion of the chest cavity. Artificial respiration refers to the measures taken to cause air to flow into the lungs by expansion of the chest cavity. Asthma, you got bronchial asthma, that's just narrowing of the airways, underline that. And then you also have cardiac asthma. It's actually the ventricular heart failure. It's actually what you would congestive heart failure. A lot of people will get that if their heart's not working good, it's not pumping, so it's not making things flow like it should. A lot of times they treat it with bronchodilators. Underline that. Bronchodilators is just what it says. It dilates your bronchioles, opens them up. Bronchitis, we know about that itis. And itis means swelling of the bronchi. So that's exactly what it is. Acute bronchitis, bacterial virus. A lot of people get that cough. Children get it, bronchitis, and that's what it is. Your bronchioles are swollen. Chronic bronchitis, normally smoking, emphysema can give you that. When you're always coughing, always swollen. Symptoms include coughing or coughing up excessive mucus. Also may be treated with bronchodilator drugs. So both of those are the same thing. Asthma and bronchitis, they very much are close to the same. Diphtheria. And you think that is totally way off, but diphtheria is lungs. You're going to see that they cannot breathe very well. It is acute infectious disease, underline that, and it's also bacterial. Bacterial. Diphtheria is an acute infectious disease, also bacterial. So write bacterial in there. Bacteria causes that disease. It spreads through contact with respiratory drops from coughing or sneezing. How is it spread? Contact with respiratory drops from coughing or sneezing. So you're touching them. They can be coughing all day, but you touched it. So that's contact precaution. You mess with them. Symptoms include blue coloration of the skin because they got no oxygen. Diphtheria can mess you up. Underline this as well. The Schick test can be used to determine immunity to diphtheria. What causes immunity to diphtheria? Schick test. Schick test. Don't be cussing in here. Schick. Chick test. If you do get diphtheria, they're gonna get bed rest, heart monitoring, breathing tubes, because it messes with your heart and your lungs. You don't want it at all. So, what are we gonna give somebody with bacteria problems? No. What are you gonna give somebody if they have a bacteria? What kind of medication? You're the doctor. What you gonna give them?
Respiratory
Antibiotics. Bacteria equals antibiotics. You're the doctor. That's all they're gonna do. Here you go. And send you right on out the door. Okay. So just remember on that. Measles. Turn on over. 49. It's a viral infection. Underline viral. Viral. A lot of those virals, we can't do much for it, but we treat the symptoms. Your body has to fight it off. We're just gonna help your body fight it off. It spreads by contact with drops from nose, throat, or mouth. Drops from the nose, throat, or mouth. Most infectious stage is the cortisol stage. Underline that. They put that on in there because they're going to ask you something about it. What is the most infectious stage of the measles? The cortisol stage. Incubation period for the measles, 8 to 12 days. Know that as well. What's the incubation period for measles?
8 to 12 days.
Okay. Your symptoms: fever, chills, runny nose, muscle pain, sensitivity to light. Underline and circle that and put it in all in colors. But sensitivity to light, measles will make you act like your eyes is gonna be just everything burns your eyes like the sun is sitting straight on and it burns. So your measles, your eyes will be swollen, you'll be inflamed eyelids, all that kind of stuff. As far as your measles diagnosis, they're gonna do measles serology. What is serology? Phlebotomy people. Serum. So they're gonna take the blood. That's what they're saying. They're gonna check the blood. When caring for children affected with muscles by measles, it is best to protect the eyes from direct exposure to light. When caring for children affected by measles, it's best to protect the eyes from direct exposure to light. How are we going to treat measles? What's one way we can do to treat it? We can't give them medicine, but we can get them out of the sunlight, get them out of the light, protect them from exposure to light. And how are we going to treat it? Medication to treat the symptoms. Again, viral, we can't really fix viral things, but we can treat the symptoms. Pneumonia. It is an infection of the lungs. It's bacteria or virus. Underline that. Either or. But bacteria is the most common cause of pneumonia. So what's the most common cause of pneumonia?
Bacteria.
Yes. We're going to diagnose it. Of course, we're going to listen to the lungs. We're going to look at the lungs. We can do x-rays, all of the chest, and listen. And what are we going to give them? If it's a bacteria, antibiotics. Viral, we're just going to try to treat the symptoms and hope you pass it. Scarlet fever. Now, this is terrible, but I have to say it. This is how another young lady, she said, Scarlet gets all the, and you will figure it out in a minute, but infection caused by bacteria, underline the bacteria, and it's called streptococcus, underline that. And underline that streptococcus causes strep throat. They've got 3 or 4 questions out of that one little sentence there. What is it caused by? Bacteria. What is that bacteria name? And what does streptococcus also cause? Strep throat. When your child has strep throat, do not let it slide. You make sure you get it treated or it moves into scarlet fever. And then it can really be messed up and die. It's no joke about it.
A baby just died from that. A couple weeks ago. She was 10.
That'll happen. I used to have strep throat all the time, and
My mama waited too late.
yeah,
she was
you
complaining about it, but she waited too late. And then she went in, they sent her to Macon, and she went in to set the shop.
Yep.
I really want to tell her.
That's what happens. You get messed up. Just the littlest thing. You got to get it treated, especially that that'll mess you Physical exam by throat cultures. All they gotta do is swab you just like they swab you with flu is your nose, but they swab your throat and they'll bring back and let you know do you have it or not. The Dick test. It may be used to determine the susceptibility of scarlet fever. So Scarlet gets all the yes, and that's how she remembered it, and she wasn't gonna forget that because she even said she knew a girl named Scarlet, and it about true. Know what she said? I said, "Oh Lord," but it helps her remember, and hopefully it'll help y'all remember too. Anything terrible, usually people can help remember that. All the way through nursing school, we had some terrible little mnemonics. It was terrible, but we remembered stuff. So, however you remember stuff, just find you a good way. That's a good one there. So remember the Dick test for scarlet fever, and those three whole things that's in that first little sentence for scarlet fever. And it's scarlet fever caused by bacteria. What we're gonna give them? Antibiotics. When they say streptococcus, they are telling you what it looks like under a microscope. That's a strip means a strip. That's pretty much what it means. A strip of coccus means circles. So when you look under a microscope, that's what you'll see. A lot of little circles together in a line. Whereas the other one that's real common, staphylococcus is the word. Staphylococcus. So staph means just a group. They just kind of grouped up. And coccus circles. So it's a grouped up bunch of circles. And that's how they describe bacteria. How they look up under a microscope, the size, the shape, and how they act. But that is, as far as your streptococcus, that's how it looks under the microscope. Also know that your scarlet fever, you'll have that swollen tongue, and of course that back throat is going to mess with you. But that when that tongue gets involved, you're letting it go a little bit too far. Sinusitis, that itis means swelling of sinuses, sinusitis. Inflammation of the sinus is due to viral, bacterial, or fungal. So that's viral, bacterial, or fungal. Everything. Anything can give you sinusitis. People are just allergic to stuff. Sinusitis. Everybody. I probably got a little something going on right now. It just comes and goes. But that's sinusitis. It can be acute, subacute, or chronic. What's chronic mean? Do y'all know? Acute is severe. We got to go to the hospital. Something I can't breathe. My sinuses are stuffed up. I can't breathe. But acute means bad. That's terrible. We need some help. Chronic means lasts a lifetime, like diabetes is chronic. It means lasts a lifetime. We can fix it, or it keeps coming back. That's what chronic means. I have chronic idiopathic urticaria. And it came on me the weekend, and I took me some Benadryl. Y'all know what that is, but I took me some Benadryl. I had to just go out, or else I was going to tear my skin up. I had itched my skin so bad I gave myself bruises. That's for me itching. Because I ain't got no fingernails.
So it's like eczema or something?
Chronic means chronic, comes back. Idiopathic means they don't know what causes it. And urticaria is giant. Chronic idiopathic giant urticaria. Urticaria means itching. And I get big giant hives that go through my skin, not just sit on top of them. Mm-hmm. Hives, how it sits on top of your skin, it itches. But mine goes through the subcute of my skin, and it can even affect like my joints and stuff. Because it goes in there and swells everything. Messes me up. And I'm like, Lord, I don't want this on me. And I went straight to, because the lady actually ordered me some weird stuff. And y'all remember this when your baby's itching. If they got hold of anything itching. Tagamet and Zyrtec. Tagamet and Zyrtec. If they got a terrible itching problem, Tagamet and Zyrtec. Because it messes with the same stuff that makes and causes you to itch. H2 receptors, which is what makes you itch. But Tagamet is actually a stomach antihistamine. Just like Benadryl, that they work on the same, but not the same kind of white blood cells. I might figure out some of that when we do phlebotomy. But all of that has got to do with you're itching. And I took that and it about put me out for a day, but I stopped itching. So remember that. If y'all, you know how your children never had just hives and they just couldn't go to sleep or something like that. They've been allergic to something. Tagamet and Zyrtec. Them two together, it's like a miracle. Because I had my disease for like a year and a half. Until that lady said, let's try a little different way. Let's go about it this way. Because you know Tagamet's for the stomach. She said, but it's an H2 antagonist. So let's try that. And it cured me. I was like, yay. And I didn't have allergies. I didn't have allergies like sinuses. But that's what Zyrtec is really for. But they work on a different way than Benadryl. Because Benadryl is normally what you take, but it really just didn't help at all. Anyway, I don't know why I went there. But I guess sinusitis can also be caused by allergies as well. They give nasal sprays. Underline that word, arganol. Arganol is often used to drain sinuses. Arganol. Underline it is a med. This is one of those nasal sprays that are going in your nose. And then tuberculosis, y'all might be familiar with it. Hopefully not, because they're trying to do away with it. It's still not to do away with it. But if you're working in healthcare, you're going to get a TB shot every time you probably walk out the door. If you get a new job, they're going to test you. And it's just because it can be dangerous, and they're trying to eliminate it. And they're going to treat you so you don't get it. If you are exposed, as long as it's not bothering you, they can just give you the medications, and they're going to check your chest x-ray to make sure it's not damaging you, and that's for your good, and that's just everywhere. Them TB is that important. Underline, infection of the lung caused by bacteria. The highest incident between 15 and 30 years old. Underline that. Your symptoms: cough, fever, fatigue, losing weight, coughing up blood. All of that. You'd be very tired and coughing up blood. I wouldn't know if y'all had TB. Y'all wouldn't be just calm and quiet sitting here. A lot of times they'll go in and check for a biopsy, but most of the times it's a CT scan and chest x-ray. If you ever test positive, and that's healthcare, you can't help it. We're going to help people who are coughing. We don't know what they got, flu, pneumonia, we're liable to catch it. Same with tuberculosis. We don't know what they got, but if you do get exposed, they give that little shot and you have a little indentation, or there's a word for that. Indentation is not the word, but it'll be a little raised area, kind of like a giant hive, but it'll be a little thicker than that, and that'll tell you've been exposed. We would know that you don't have it, or else you'd be coughing probably in the hospital. But that's when they sent you to go get your medications, because anytime you're exposed, actually your lungs takes that little antibody or antibacterial, that part, and encapsulates it in your lungs and protects you from it.
They ain't give me none.
And that's what they'll do. Well, they checked your chest x-ray, I'm sure, right?
Yeah.
Then you were fine.
Oh. Because
it doesn't have to happen. But that's why they do the chest x-ray. If you do have those, they call them little nodules, and that's your body encapsulating it. If it's done that, then they're going to give you your medication because it dissolves it. And the yeah, it happens.
My mom said she had one of those.
Yeah, it happens. You're in healthcare. You know, that's what we do. We go help people who are sick.
I'll let you know that they sick.
Yeah,
They about to have it. They won't tell you though. It was one of the patients. He had it, but he didn't tell nobody to.
Oh man, don't give it to me. But guess what?
Long as he had to go step in with somebody else.
long as it's not a terrible thing. I remember my friend, a guy. Of course, he was in jail for I don't know a little while, but probably about 9 months. But in jail, tuberculosis floats. When they give you a mask, it's called an N95 mask. That mask, it's got the little bitty holes in it. That's about the only mask that's going to keep tuberculosis away from you. I mean, they are little. And if you got tuberculosis way over there, the way it floats in the air, I'll probably get it. We're all exposed. But that's how it happens. And in jail, everybody's there. In colleges, everybody. That's just how it happens because everybody's kind of together. But he had got it, and he thought somebody had gave him like a sexually transmitted disease. Oh my God! I don't know what to do. Somebody gave me the TB. I said, what? You know. But that's why he went to jail. And he probably would have never known it unless he went to work in healthcare, and they did him a TB test. But but they did him, and his lungs were fine. They didn't have to do anything. But he just he was like, well, who could have gave me a TB? Like he was, you know, who was I up against? That was even, you know, who was sick, and I was up against her. I said, it doesn't happen like that. It floats. I mean, it floats. It literally floats. So it was funny. But the medications underlying those as well, isoniazid and rifampin. Those are your two medications that you're going to take for tuberculosis.
Pronounce it again for me.
Isoniazid and rifampin. You will have those.